Hi, my name is Jessica Gavin. Today is 7/1/2020. I have my notes. We have the name of the bones, the front and the back. So today we're talking about the skeletal system of the human body. The main components of the skeletal system are the bones of the skeleton. We also have cartilages such as the nasal cartilage. We also have ligaments such as our meniscus, like in our knee. We have other connective tissue, and that's such as like our tendons. We have a lot of tendons, for example, in our wrists. The classification of the bones by shape, we have our sutural bones. Those are the bones that are within the suture lines up here. We have our flat bones that surround it, and the sutural line has little bones that are irregularly shaped, and they're also called Wormian bones. We have pneumaticized bones, and those are going to be bones like the ethmoid bone that are really airy and light. They have air pockets. We have short bones, which are the bones such as our carpal bones, like the hamate and the capitate. Then we have the bones in the feet, the tarsal as well. We have our irregular bones. Those are going to be like the bones in your spinal column, the vertebrae. We have flat bones, like I mentioned before. We have our parietal bone and our frontal bone, bones like that are really flat and pretty regularly shaped. We have long bones. These are bones such as our humerus up here, and our radial and our radial bone and our ulna bone. We also have our sesamoid bones, and the sesamoid bones are like the round, flat bones, such as our patella. One of the major clinical applications I can see as a PA are going to be in like urgent care or ER type of situation. A lot of times they will see a lot of bone fractures. In my current job, I've actually seen an awful lot, and I imagine that we'll see an awful lot of this in PA school as well as being a PA. One of the major fractures that we see are the Colles fracture. This is where you are falling down and you cushion the blow with your radius bone. So you land like this right on your wrist, kind of like that, and it pushes up. It breaks that distal portion of your radius. Usually requires a cast. One example that I've seen of this is actually a friend of mine. She had an ATV accident, and she was riding the ATV like this and toppled over and landed right on the radius bone and broke both of them. So she had to have a double cast for months. So that's something I think that we're going to end up seeing in a lot, especially if people are active and they're moving around or doing any kind of sports, those types of things. So as far as the bones go, I'll start labeling those. We have our cranium up here, and in the back, we have our occipital bone. We have our parietal bones right here on the sides. We have our left and right. We have our frontal bone here. We have our temporal bones here on the sides. And then we have our sphenoid bone right here. We have our ethmoid bone, which is more in the back. It's hard to see back there. And then one thing that I want to mention too is our foramen magnum. It's not a bone, but it's a foramen. It's just like a hole. And that leads into our spinal column here. So of our vertebral column, we have our cervical column here. We have our cervical vertebrae 1 and our cervical vertebrae 2, which are both different shapes than the rest of the cervical vertebrae. Then we have cervical vertebrae 3, 4, 5, 6, and 7, all also called C1 through 7. We have our thoracic vertebrae. We have T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, and T12. And then we go into our lumbar vertebrae. We have L1, L2, L3, L4, and L5. That leads us into our sacrum here. And then we have our coccyx down here, that little pointy bone at the bottom. A lot of times people will complain that they break that, and that is painful. Then we have our pelvic girdle, and with that we have our ilium up top. In the back here, this pointy part, we have our ischium, and then we have our pelvis up front here. For the thoracic area, the rib cage here, we have our clavicle. And then in the back, we have right and left of those. In the back, we have our scaphoid bone, which we have right and left of that. I'm sorry, our scapula bone. Then our ribs, we have ribs 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Then we have rib bone 11, rib bone 12. Rib bones 11 and 12 are called our floating ribs. Rib bones 1 through 7 are going to be our true ribs. And then the rib bones 8 through 12, these ones on the bottom here, 2 included, they're also called our false ribs. We have the sternum here in the middle, and we have the manubrium of the sternum, the body of the sternum, and the xiphoid process of the sternum. When you're doing chest compressions, make sure you don't hit that xiphoid process. Then we have our costal cartilages here that connect the sternum with the rib bones. For our upper limb, we have right and left of this as well. We have our humerus. We have our ulna, this longer, thicker bone. And then we have our radius. For the carpal bones here, we have our, let me pull up my little cheat sheet. We have the lunate here in the middle. We have the scaphoid bone, the trapezium bone, the trapezoid bone. Then we have the capitate, the hamate. And then we have our triquetrum bone. And then right on top of that, just like a little ball, is our pisiform bone. For the fingers, or our phalanges, we have our metacarpal bones. We have metacarpal 1, 2, 3, 4, and 5. And then we have our phalanges, which are, we have our proximal phalanges, 1, 2, 3, 4, and 5. Middle phalanges, there is no middle phalange on the pollex. So we have, or the thumb, we have our middle phalange 2, 3, 4, and 5. And then down here we have our distal phalanges. We have distal phalange 1, 2, 3, 4, and 5. For the rest of the body here, for our lower limbs, we have our humerus bone. I'm sorry, this is our femur bone. I apologize, had a blank there. And then we have our patella, which is like our kneecap. We have our tibia and our fibula. And then we have our tarsal bones here, which are the bones of our feet. See if you can get a good angle on this here. We'll see this side here. So we have, you can probably see it a little better. So we have our calcaneus bone, which is the bone here in the back. And then we have, that's our heel bone. We have our talus. Then we have our navicular bone. Then we have our, what is it called? Our, cuboid bone. And then we have our cuneiform bones here. We have our lateral cuneiform bone, medial cuneiform bone, and medial cuneiform bone and intermediate cuneiform bone here in the middle. So lateral, medial, intermediate. And then we have our metatarsal bones. We have metatarsal 1, 2, 3, 4, and 5. We have our proximal phalanges. We have proximal phalange 1, 2, 3, 4, and 5. And then we have our middle phalanges. We have middle phalange 2, 3, 4, and 5. It's the same on the feet as it is on the hands, where the main toe does not have middle phalange. And then we have our distal phalanges here, distal phalange 1, 2, 3, 4, and 5. And that is the bones.